John.
Hello.
John, we are very excited at the Beljanski Foundation about this new paper you told us about Rauvolfia vomitoria. Can you tell us more about it?
Sure. What the paper shows is that Rauvolfia vomitoria extract is extremely effective for the condition known as BPH, benign prostatic hyperplasia. As men age, their prostates get larger. This is a real problem for urination and ultimately for quality of life. And the Rauvolfia vomitoria extract resolves this problem.
We already had a paper on with Pao Pereira on BPH. How that is different from the Pao Pereira paper, and how does it complete it?
Well, I think the actual scientific data are very similar, meaning in this case, the Pao Pereira extract and the Rauvolfia vomitoria extract behave very similarly. They both shrink the size of these enlarged prostates and reduce the phenomenon of BPH and alleviate the symptoms. So they're both working that way, and they both work through a hormonal pathway. They inhibit the transition of testosterone to dihydrotestosterone, which is the active form, more active form, which is responsible for triggering overgrowth of prostate cells and enlargement, leading to the BPH condition.
So is there a preference? Why would one man use one rather than the other, Pao Pereira rather than Rauvolfia, and vice versa? How to choose from?
Well, I think you could safely choose either one of them. They're both good, and right down to the point where they both, what the authors did, and this is from Nanjing University in China, Dr. Jun Yan, also tested these extracts and compared effectiveness with the drug finasteride. This is a very widely prescribed drug. It helps men with this condition of enlarged prostate, but it also induces a number of side effects. And it doesn't look like these plant extracts induce any side effects. And both the Pao and Rauvolfia appear to be side effect free. And what Dr. Yan did is look at sperm count as a great example of a negative side effect of the finasteride. Because after finasteride treatment, the men see significantly lower sperm counts. This is one of the negative side effects. With the plant extracts, this doesn't happen.
Would that make sense to use both extracts, Pao Pereira and Rauvolfia extract at the same time?
In my view, I think using both together would best be reserved for more serious conditions, meaning a prostate cancer, for example. The inflammation seems to be very well handled by either one of the extracts alone. Both together, as we know from our own work at the foundation, the combination of these extracts is synergistic. So you get a real benefit by bringing the Pao Pereira with the Rauvolfia vomitoria together. And I think that extra effect is best taken advantage of for, say, anti-cancer instead of just anti-inflammation.
So what you are saying is that the same compounds that are being used for treatment, for prevention, meaning here in this case BPH, could also be used for treatment.
That's right, for treatment of cancers, prostate cancer. We also know in the case of Pao Pereira extract, work from Nanjing University, also from Dr. Yan's laboratory, show that the Pao is effective against hormone-independent prostate cancers. That's advanced cancers that no longer respond to hormone treatments. So the full spectrum we're seeing here, from chronic inflammation like BPH through to cancers of the prostate and ultimately to advanced cancers. So these extracts are effective in a broad spectrum of stages.
Does it mean that it could eventually prevent going to the next stage?
That's my interpretation. Those experiments haven't been done specifically, but the earlier you catch any inflammation or cancer initiation event, carcinogenesis, the better off you are in terms of preventing progression. So I think both of these extracts can play a role in prevention as well as treatment.
We have received this new paper about Revoltia vomitoria and about BPH, which completes this paper we already had on Pao Pereira and BPH. But BPH is a form of inflammation. Can we expand the interpretation of those two papers recently received and see kind of action of both Pao Pereira and Revoltia vomitoria on inflammation at large?
Yes, I think there is a third paper in this small collection showing that the Pao Pereira extract is inhibiting in a BPH. It inhibits the NF-kappa B signaling, which is directly responsible for pro-inflammatory cytokines being released and for advance of the BPH condition. So really what you have is two approaches to the problem. One is hormonal, which is extremely interesting, and I just described that, but the other is NF-kappa B mediated pro-inflammatory cytokines, which Pao Pereira has been shown to inhibit. So that's a formal, if you will, inflammation pathway that isn't hormonally connected, but it is related to the release of pro-inflammatory cytokines, which need to be curtailed. They need to be inhibited for the condition of BPH to be resolved. I could say also that NF-kappa B was shown in the work from China to be at play, inhibition of NF-kappa B in the advanced cancers that are no longer hormonally dependent. You can't treat them any longer, and the guys basically are left often without any treatment options from traditional medicine. But the Pao Pereira acted there to inhibit NF-kappa B production of some of the markers for advancing cancer.
Okay, so you were speaking at the beginning of, to make it clear, of BPH, which is inflammation precancerous.
Yes.
Now you are speaking about advanced prostate cancer, right?
Right.
So it is what you are saying basically is that now we have publications showing that the compounds Pao Pereira and Revoltia are covering every step, right?
That's right. There's no other step that I'm aware of. So I think these things work very effectively.
At every step. So you can start you can start to use those products at any stage, basically, of the disease of the prostate.
Yes, and you can even start to use them before there is any stage at all. So that would be prevention. Once a man gets to a certain age, depending on his health and his conditions, he might want to take one or the other of these extracts with a view to preventing the inflammation and preventing cancers of the prostate.
So when you say preventing inflammation is kind of reverting to a normal healthy stage, right?
Yes, that's right. And I think that that can be done for I think it's fair to say, for advanced inflammation, there's some phenotypes there would make it look cancer-like. There is damaged DNA in chronic inflammation that's been there for a while. And that we know is a characteristic of cancer cells, DNA damage. And these extracts target that. So at one extreme, they can actually get rid of the cells that are advanced inflammation in the way they do a cancer cell. But we also have this NF-kappa B pathway, which is pure anti-inflammatory. And if we can inhibit those in those cells, we alleviate the problems associated with BPH.
So we have different mechanisms of action working at the same time.
That's exactly right. That's right.
Excellent. Thank you, John.
Oh, you bet. Thank you.